Good morning, everyone. Is my mic working? Sounds okay? Awesome. Well, thank you all for having us. It's awesome to be here. I think this is like the first big in-person event that at least I've done in like 18 months, which is pretty exciting. And thank you for the warm welcome. And it's great to be down here in sunny, warm, Indianapolis compared to Northwest Indiana, where we've probably got snow by now. So yes, both Gabe and I kind of got into this, kind of stumbled into this. It wasn't like we set out and we're like, hey, we're gonna, track this COVID pandemic and, do this for years. And, honestly, I think both hoped that we would be done a long time ago, but it just keeps going, unfortunately. So maybe some of you are familiar with what we've done on the Facebook page and on Twitter. If you're not, we're just going to spend a few minutes just telling you a little bit about who we are. So you're not like, who are these weird people that I'm here listening to? So a little bit of background about who we are and what we've done. And then hopefully we'll be able to spend half the time or most of the time just answering questions, talking about our experiences, giving you a chance to like ask anything you want to know about and what we've done and what we've gone through. So about me first, real quick, I'm a professor of economics. I started tracking data about the pandemic and COVID-19 since the beginning back in March 2020. I've been really active in the media, just like Dr. Bosslet, Gabe has been as well. Two questions that you might have since I'm going first about me right away, which is, why is an economist looking at COVID data and health data in the first place? And that's a big one. And then other question maybe is, why am I doing it on Twitter? Later in the talk, we'll talk a little bit more about different social media platforms, but maybe some of you, Twitter seems like a weird choice. Why not Facebook? Why not TikTok? Why not something else? But there's a reason I chose Twitter. So I want to try to answer those two questions, and while doing that, give you a little bit of a background about myself as well. So if we go back to March 2020, which feels like decades ago now, we were just learning about COVID appearing in the United States and in Indiana. This was the earliest I could find. It's not the very first version of the dashboard that the health department had, but it's a really close one. It's I think it was like March 17th of 2020, and this is how it started out. It had a map of Indiana. This was the whole thing, by the way. There was nothing else. There was no other data downloads or graphs or anything. Map of Indiana, and those yellow dots over there, those are counties that have a case of COVID, right? So like if your county goes from 0 to 1, they're like, put a dot up there, and that was it, right? And so you can see total cases, total deaths, 159 people tested, right? Of course, 2 years later, this looks very, very quaint. But at the time, I wasn't really happy with this. I saw this and I'm like, okay, this is neat, but tomorrow these numbers are going to change. And are they going to change by a lot? How are they, what's going on with the trends? And so I wanted to know a lot more. I had questions about, okay, what is this going to show? And I just don't want to know what the snapshot is now. I want to know how things change over time. And so that's kind of what motivated me to start looking at this COVID data, because I had a lot of questions about it, as we all did, when this was happening. And so my goal was to try to answer some of those questions. I'm an economist. I'm used to looking at data. I'm sitting there on like spring break. I'm not teaching my classes right now. I'm concerned about the situation. And so I started asking these questions, and I want to try to find answers to them. What's happening. And when I started, I was focused mainly on Northwest Indiana, where I live, because I wanted to know what's going on around me. Like, I care about you guys in Indy, but like in terms of cases and stuff, I just want to know, is it safe for me to go to my grocery store, that kind of a thing. So I started out very regional. And then I also wanted to look at trends, because they'd update the graph tomorrow, and then that chart tomorrow, and then all the numbers from today would be gone, and I'd like, how many new cases are there? How many new deaths? That sort of stuff wasn't even published back then. I mean, now we're spoiled. And then also lots of uncertainty about how deadly it is, kind of like how, now with the Omicron variant, we're asking the same kind of questions. Is it deadly? How's it compared to the flu? How's it compared to the, Delta? How does it compare to the original variant? And so questions like that were stuff that I really wanted to answer. And for me, because I teach economics and I do lots of graphs and lots of figures and pull in data for my students to look at, the number 4 was a big one, which was, I just want to see graphs that show whatever. Like, I want to see cases over time. I want to see positivity rate over time, all that kind of stuff. And so for me, a lot of this was just, hey, can I get a graph that looks like this? And they didn't have it, so I just made it myself. And another big factor is, again, I'm sitting at home, sort of locked down, and so much felt like it was out of my control. And one way that you can kind of maybe regain some of that control is by informing yourself, knowing what's going on. And I think that's something that really resonated with a lot of people. When I started posting these kind of things, I got tons of people that, they were downloading screenshots of the dashboard every day as well. And they had like a folder there, sticking them all in just like I was. And so I think a lot of us kind of felt the same way. And I think that really connected with a lot of people. So that's kind of how I got sucked into it. why Twitter? Part of it was I wanted something that was really geographically located, regional. So I wanted to hit people that were in like my area, Northwest Indiana first, and then eventually Indiana. And I don't know why, I just thought like Twitter that's just how it worked. Like, people can search for stuff going on near them. And I also wanted to practice being concise because, when I write articles or when I talk in front of my students, I would just kind of ramble on and on and on. And this kind of forced me to like take 2-page long things and condense it down to like 280 characters, which was really tough and challenging, but it was a great experience. And actually it's helped me a lot in my writing, because now when I write a research article, instead of writing paragraphs and paragraphs, I put in a sentence, and then it's just so much more concise and direct, which is awesome. And then also I just wanted to experiment, trying a new social media platform. I mean, Twitter's now kind of like, we'll talk about in a minute, but kind of like dying maybe a little bit, or aging at least. So maybe I should have picked a better one like TikTok, but that was at the time, that was kind of the trendy one. I went from, I had a Twitter account with like a few followers that I'd set up in like 2011 or something, and I never logged in, and I started using it. And, since the start of the pandemic, I went from about 20 followers to, around almost 5,000, which is pretty impressive, I think. Not as impressive as you hear from Gabe in a minute for some of the other stuff, but for me at least, that was a pretty impressive achievement. And I wanted to share with you, this was my first COVID graph that I ever posted on Twitter. This was on March 22nd, 2022. And it's just looking at number of cases, and then like the percent, there's the number of tests, and then percent of tests that were positive. And I made all sorts of mistakes, like the dates are going the wrong direction, like the newest is on the left. And I'm like, that makes sense because I want to see the newest first. But then I fixed it later. And so a lot of this has been like experimenting with how to make graphs and make them better and make them more effective. And they've gotten better over time. I want to show you, so this is also kind of the second tweet I made on COVID, which I think captures in like a nutshell perfectly everything I've done on Twitter for COVID, which is I wasn't seeing the graph I was interested in, so I made it myself, right? And that's kind of how I started, and that's kind of how it's been going ever since then. I want to share with you a few graphs that are more recent that I've like had time to kind of streamline and get feedback and perfect a little bit. And so this is just a graph of cases over time. This goes through Thanksgiving. So we don't have, the numbers have been kind of weird since Thanksgiving, so they're not on here. This is just up to Thanksgiving. And it's just a graph of cases, but I feel like you want to make graphs as intuitive and simple as possible. And so you can see the colors there. When it's red, that means that there's been 3 or more days in a row of cases increasing. So you can just take a quick glance at it and be like, okay, I see where things are getting worse. I see where things are getting better. The gray areas, it's kind of like ambiguous. It's not really clear. And it was just a nice visual way to kind of quickly and easily see what's happening. And that's what I try to incorporate in my graphs. I try to figure out, how do I make the graph like the most intuitive, the most obvious, so that if you're like, I have this question, I have this burning question I need answered, and then bam, this answers it exactly, right? That's what I'm trying to go for. And I miss sometimes, but over time, like perfecting and kind of reworking graphs has helped a lot. This is another one that I really like. It's a lot going on if you haven't seen it before, but the green line, so these different panels are different age groups, youngest up there in the top left and oldest down here in the bottom right. And the green line is the percent of the age group that's been vaccinated over time. And so this is a little bit older data. This is at the beginning of year, February through March. And you can see that the older groups back then, if you can remember, they were getting vaccinated. The younger groups weren't really eligible yet. If you were getting vaccinated, you'd have to be a healthcare worker. And what I want to show about this graph is that it captures something really nice. It captures the effect of vaccinations on cases. So the black line is cases. And I got a pointer here. So if you look, if you look here, the 30 to 39-year-olds, so not very well vaccinated, less than 20%. And we're starting to enter a period where cases are starting to tick up, right? So, and you can see that here, 20, 29-year-olds, cases are going up, cases are going up. These groups are not very well vaccinated on the green lines. Then you come down here where you get more and more vaccination rates. And you can see, yeah, still ticking up a little bit, ticking up less, flat, right? And so it was a way of just showing kind of in one graph, the difference of vaccination rates by age group here and how that affects cases. And now, of course, most of these groups are much higher. This is one that now if you go to the CDC's data tracker, I don't know if I can take full credit for it. Maybe I can take a little bit of credit. They have the same graph. And the White House director of COVID response did respond to this when I posted it and comment on it. So I feel like maybe I influenced it a little bit, but it's just kind of a neat way to look at some data. This is another one I posted recently. I just want to share this as real quick. So this is ICU bed usage in Indiana, and the black line is the maximum capacity we had before COVID. So before COVID, we could fit maybe 1,400 and a little bit more people in ICU beds across the whole state. That's the black line. And then the red and the blue are how many we've had in ICU beds on a given day. And so when it's red, that means that we have more people in ICU beds on that day than the maximum we could have had before COVID in all the ICU beds in the whole state, right? Which is crazy. So it's not like we're, ICU beds are a little bit up over like the normal levels. They're over the maximum levels we had before. And, we've expanded ICU beds. That's how we can fit them in there. But, what's really hard to expand quickly is people, right? So we don't have workers to necessarily take care of those beds. And you can see it's almost all red. So, 3/4 of the last 600 days, Indiana has more people in ICU beds than the maximum they could accommodate before the pandemic. And it just keeps going, right? And so our healthcare system is incredibly stressed. And so this was trying to show kind of in a graph how much healthcare workers have gone through. And this is just ICU beds, but you could extend this and look at data if you got it for regular inpatient beds, and it would look very, very similar. Right? And so I'm trying to put these snapshot kind of graphs up there that really capture a single thing. This is another one. When we started out doing stuff on social media, there's lots of backlash, conspiracy theories, people denying COVID is a thing and it's just the flu. And so this is another one. This is an updated one, but one of the first graphs I ever made that, this is, I think Gabe found me originally, was looking at deaths from flu versus COVID. And so on here, this is going back to 2016, the start of 2016. The blue vertical lines are the number of deaths from influenza per week. And then the red is where you get to number of deaths from COVID, right? And so when you look at it this way, it's not going to convince everybody, but if you're kind of on the fence, like, well, maybe it's not as bad as, maybe it's just about as bad as the flu. I mean, you see this and it's kind of like, okay, well, we're talking totally different orders of magnitude here. And like I said, this was one of the first graphs that I think, Gabe met me through, because I posted an early version on Twitter. It was just like a few weeks, and it wasn't conclusive then because it was really early on in the pandemic. I mean, now it's kind of overwhelmingly obvious that it's not the flu, it's something totally worse. I mean, you can look at the numbers there for total deaths. This is, since 2015, it's just, and the COVID is just the last year or two. So, but I posted that, and lots of people that said, yeah, you're misleading people, blah, 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 and lots of, conspiracy theories and misinformation and stuff like that. But that's kind of where I met Gabe. And meeting Gabe on Twitter, this is the second time we've ever been together in the same room physically before. Believe it or not.
Although the bromance has been for at least 18
yeah,
months.
on social media, you may see us bantering and stuff like that, but this is only the second time. We met briefly for lunch once, like a couple months ago, I think, in the summer, but that's it, right? And so we've only ever met on social media for the most part. And the reason that he's been so helpful for me is that I'm an economist, right? And if someone comes to me and is like, yeah, you're graphing this, but what do you know about influenza and COVID deaths? And you're not in the hospital, you're not a medical doctor. And I wouldn't be doing this still if I hadn't met Gabe. Like, I probably would have burnt out like within a few months because I couldn't handle those types of questions. There's no response. I'm like, yeah, I guess I don't know what I'm talking about, right? But with having Gabe and some others, Dr. Roger Johnson in Evansville is another big name that I've leaned on a lot. I have someone I can go to, be like, hey, this guy's asking a medical question and is trying to debate me on this. I don't know the answer. Can you chime in and like help me? Or can you answer some questions for me? So it's been really helpful. I kind of do a little bit more of the data analysis and the graphing and stuff like that, pulling up the Excel spreadsheets and digging through the data. And then when there's medical questions, that's when I point over to Gabe. So it's been a really helpful kind of collaboration. That's a little bit about me. I want to turn over now so Gabe has a chance to tell you a little bit about himself and kind of his experience. I think has been a little bit different.
So I'm Gabe Bosslet. I have been here since 2007. I'm an ICU physician at University Hospital and Eskenazi Hospital. And so, you can understand that the last 18 months for me has been, I think awful would be a massive understatement. And we can talk as much or as little about sort of the nuts and bolts of that as we want. But I'm going to talk a little bit about sort of the journey that I've had over the last 18 months in sharing information with the public. That has led to a lot of stuff, including my relationship with Micah, which I treasure greatly, frankly, and being on CNN with Don Lemon a few months ago, which was both nerve-wracking and cool. And my story of COVID-19 data reporting is really tied very closely to the Hoosier COVID-19 update page, which I started April 18th of last year that I'm going to talk about in a second. But the way that came about is through my wife's cancer diagnosis. So Sarah and I have been married for 21 years. And as COVID was bearing down on us, she had a mammogram that was abnormal and had a biopsy and was diagnosed with breast cancer. And so not not only was the worst pandemic in a century bearing down on us and me as an ICU physician and also a fellowship director directing 21 trainees in sort of how to become a critical care physician. These trainees are hot and heavy in the intensive care unit, so I'm worried greatly about them. This happens. And so we navigated chemotherapy and multiple surgeries over the last year, in addition to navigating the COVID-19 pandemic. And the reason that this ties in so closely is because as the pandemic was bearing down on us, Sarah was on chemo. And so she was immune compromised, and getting COVID would have been bad. And so I can remember I had a meeting. I was working from home because everything was shut down. And so as the fellowship director, I do a lot of leadership stuff in our division. And I had a meeting with one of our fellows. And that meeting was about using one ventilator to ventilate 2 patients, which had never been done before. But this fellow was an engineer and had been working on this and had this it was so cool. We've never had to do it yet, and I hope never to, but boy, the stuff that we came up with was really awesome. And so I got off the phone, I was all jazzed, and I went in the bedroom, and Sarah was in there folding clothes or something, and she's like, hey, tell me, what was that call about? And I kind of started telling her, and she goes, you're not going to be able to do any of this stuff, right? And I kind of looked at her, and I don't know why I didn't realize this before, but she goes, you're not going to be able to go in the intensive care unit for a while, at least not until I'm out of chemotherapy. And that moment, I was like, oh my gosh, you're right. And sure enough, a few days later, my boss called me. He was like, Gabe, look, you have 2 weeks in the ICU coming up, and I'm not going to have you go in there. You can keep doing leadership stuff from home. You can have clinic that we were mostly doing virtual anyways. He's like, but you can't bring this home to Sarah. And that filled me with a lot of emotions, right? So I was massively grateful to my colleagues and my division chief for protecting me and Sarah. But there was a lot of shame wrapped up in that too. Because look, this is the Olympics for me, right? I've trained for decades to care for COVID patients. And this was going to be my, back in March, I thought we were going to have, this is going to be my one shot to care for these patients for the next month and a half, and I'm going to miss it. And boy, was I wrong. So Sarah, by the way, is doing great. She is through chemo and surgery and cancer-free. And that's us with my daughter. Thank you. I thank you for her, I guess. She did all of it. So I had nervous energy. So the bottom line of all this is, you can tell, look at me, I'm walking around, I'm a nervous individual. I idle hot. And I had all of this nervous energy that was literally, I was like a dog being held back from getting into the intensive care unit. And so I had to figure out a way to channel all this energy. So otherwise I would have been a basket case, frankly. And Micah mentioned Twitter. I love Twitter. I think it's a marketplace of ideas. I know it's not as popular as TikTok now, but I'm still big on Twitter. And by that, I mean, I like to use Twitter a lot. But the problem for me was Twitter was an echo chamber, right? I'd go to Twitter and be like, hey, this is getting really bad. And everybody else was like, yeah, it is getting really bad. It's terrible. Like, everyone that I followed knew what was going on. It's all intensive care unit physicians, medical educators, et cetera. So it was unhelpful for me to go there and scream, because everyone was screaming the same thing. So where do I go? So I'm going to take a little bit of a sidetrack here and talk. But before I do, so what I wanted to do was go and share information in a very plain and simple way for the public. That's what I wanted to do. I'm a medical educator. I teach people to be doctors. And what that means is taking complex information and distilling it down to a meaning, to the meaning channel for people, and getting them to understand it as well. And I knew I could do that well for the public. And I had a thirst to do this too. And there was a lot of misinformation. So where do I go to do this? And so, okay, so I'm going to ask. So raise your hand if you have a Facebook page. Wow, most people do. Okay, what about Twitter? Okay, what about TikTok? Okay, all the young people. Okay, so look, Twitter is kind of the boomers' playground, right? And I had Facebook is kind of the boomers' playground, although Twitter maybe now at this point. So I had a Facebook page, but it was kind of shuttered because after the 2016 election, I kind of stopped with Facebook, but I kind of dipped my toe in again to look around and see what was going on. And I realized, holy cow, this is where I need to be, because these people don't understand what's going on. So I unshuttered my Facebook page, and I would go every day to the State Department of Health's website and download a press release and pull the number of cases off of the press release. And I made a very simple graph, much more simple than Micah's. I've stopped making graphs because Micah's are so beautiful. And so I just messaged him through Twitter, hey, what about this graph? Can we make this one? But this was the first one that I posted March 18th, I think, of last year.
He did message me like last night. I'm driving down here and he's like, hey, can you make this graph?
I did.
Like, no,
he was like, I'm on the road.
this
You
thing.
know that I'm traveling. This is the first graph that I posted on March 18th. And I did it for myself, frankly. I mean, I'm getting rid of nervous energy. Micah talked earlier about sort of owning information in order sort of to own your own discomfort with the situation. Definitely what this was. This was for me, not for anyone else. But I started posting every day with a little commentary on what was going on. And I had inside information because I knew what was going on in the hospitals. And I knew what we were doing to prepare as well. So that put me in a perfect position to be able to do this. So I started sharing this and people started sharing these posts with other people. And then I started getting a lot of random Facebook friend requests from people that wanted to have access to this themselves. And I decided it was too much. And so I started a page. I started what's called the Hoosier COVID-19 Update. I started this on April 18th of last year. And I called it the Hoosier COVID-19 Update because I'm a born again Hoosier. I was not born here. I was born in Missouri and I lived in Ohio and I just moved to Indiana in 2007. I love it here. I'll never leave here. My wife's a Hoosier. And so I was kind of, she indoctrinated me. But I was like, look, I'll start this page and I'll focus on the state because the State Department of Health had a terrific website where I could get statewide data very easily. And I'll distill stuff down and really target it on the population of people who live in the state of Indiana. And I thought, honestly, when I did this, that it would be for me mostly, but a couple hundred people might be interested. And boy, was I very wrong, because within a week, 1,000 people were following it. Within a month, 10,000 people were following it. And now there's like 45,000 people who follow the Hoosier COVID-19 Update page. And early on, we would post once a day. I would post literally, I got to go back and look. I posted every day for probably 6 months, graphs and commentary on sort of what was going on. I have never been more prolific in my entire life, and I never will again. This muse will leave me, and I will be happy when it does. But now I post. Then I posted for a little 3 times a week. Now I post just once a week, and it is an awesome community, an awesome place where people come for information, to share information. The comments are usually very benign and a great place to be. And so that's kind of how I got started in this. Mike and I have done Facebook Lives. We haven't done any for a while. I don't like doing them, frankly. I don't like my face out there that much. It makes me uncomfortable. We did probably 2 or 3 of these. They were fun. I was floored. How many people watched those?
I think we had about 1,000 live.
Like there were like 1,000 or 1,500 people watching it live. I was like, I cannot believe this. And so those were fun too. And look, we're both academicians, and having never met each other in real life, we realized as schools were starting to open in 2020, hey, we've got to study this, because there was a huge debate about what to do with schools. And we're like, look, how can we capture, okay, schools are doing things completely different all over the state. How can we figure out how to capture the effect of kids going to school on local transmission of COVID-19? So we did a statewide study and actually got it published in the Journal of Clinical Infectious Diseases, which is a pretty good infectious disease journal, looking at the role of school opening and the percentage of kids attending school in person last year on local transmission of COVID-19, and found that it does have an effect, but that effect was actually pretty small, somewhere around 1 or 1.5% of an increase in cases for every 25% increase in kids that are in school. So we were able to take this sort of social media thing and turn it into actual scholarship, which makes me really happy, because I would have been bummed had this not turned into something cool like that. So that's kind of where we come from. And we thought that now we would just take some questions. So